you very much. Now recognize the gentlelady from Washington, Dr. Schrier, for her 5 minutes of questions.
Thank you, Mr. Chairman. Thank you to our witnesses today. Thank you to Dr. Joyce for his comments. I wholeheartedly agree. I'd like to talk about Medicare Advantage today, specifically with regard to prior authorizations. Just to set the stage, I'm a pediatrician and took care of kids in my community for almost 20 years before coming to Congress. I also have had type 1 diabetes for over 40 years, so I get what it's like to be a patient who is dealing with difficulties with insurance companies. And now I'm a member of Congress, and I hear a lot from my constituents, and I am here to go to bat for them. So I'm not sure it's not a news flash for you, but just so you know, people are pretty pissed off at their insurance companies because they are paying more every single year, and they feel like they are not getting the value for it, and like you are not living up to your end of the bargain. I mean, their insurance companies, your companies, are charging more, paying less, and then delaying or even denying care due to abusive demands for prior authorizations. And I hear the same, by the way, from hospitals, from physicians. They are telling me that they are forced to hire more people to deal with your paperwork than nurses. And that is just plain wrong. Now, particularly when it comes to Medicare Advantage, not only do you delay that care with prior authorization demands, but you sometimes flat out deny claims after the services are already rendered. And here's an example. One of my constituents had a stroke, required hospitalization. This patient had a UnitedHealth Medicare Advantage plan, and UnitedHealth refused to pay for that hospitalization because United decided that it was medically unnecessary, overriding the doctor's own medical decision. And so now we've got this senior who's in the hospital, can't go home, stuck with a huge bill, and that is just unconscionable. And it is shameful that you're doing this to people on Medicare Advantage. I mean, they paid into the system for their whole lives. They're paying premiums now. They're counting on you to look after them. And I just want you to think about how many elderly patients who suffered a stroke can then go home and deal with sitting on hold with customer service and submitting letters in the appeals process. And it took over a year, by the way, for UnitedHealth to finally pay. Mr. Hemsley, if a patient's physician has determined that their patient should be in the hospital after a stroke, why would UnitedHealth decline that care?
I'm not familiar. I appreciate the question, and I'm very sympathetic to the situation that you described it before. I'm not. I don't have specific knowledge.
You don't really need specifics, like senior suffered a stroke, doctor said this guy's not safe to go home, and United overruled.
They should get all the care that's appropriate for them, yes.
Thank you for saying that, and I will communicate that to my constituents and go to bat for them. I will tell you that paying a bill is the last thing patients should worry about after having a stroke, and doing this because a multi-billion-dollar company doesn't think that it's necessary for them to get their care. I mean, this is why so many people hate their insurance companies. They pay a lot of money, they expect peace of mind, and then the insurance company leaves them high and dry. A lot of you run Medicare Advantage plans, but UnitedHealth is the poster child for Medicare Advantage abuse. I mean, we all know about padding diagnoses, so you can make patients seem sicker and riskier and then overcharge the government for their care. But today's focus really is on prior authorizations and denials, which you demand more than other insurance companies that take care of Medicare Advantage patients. And most patients, they just shrug their shoulders, they give up. But the ones who do appeal, 80% of them get their appeals covered. If these denials are ultimately overturned, why are you doing these pre-authorizations and denials?
Well, I appreciate the question, Representative. We have been methodically reducing the area of prior authorization and expediting that process. We are not trying to do anything other.
I'm with 15 seconds. I'm going to hold you to that, and I will follow up with you about what you're doing now. But I have to tell you that to the rest of us, this looks like your business model. It looks like you bet on wearing patients down, on them not appealing, and then they either decide to just eat the cost or they die before they get the care they need. And my constituents are sick of it, and we're sick of it, doctors are sick of it, and people deserve better. So we need Medicare Advantage reform now. Thank you.
Gentlelady yields back. Now recognize the gentlelady from Iowa,